Welcome to Boulder County AIDS Project HIV 101 presentation. Today we're going to discuss the following topics. What is Boulder County AIDS Project? Why is it important to learn about HIV and AIDS? What is the difference between HIV and AIDS? Then we'll talk about HIV transmission, risk reduction, testing, and treatment. Boulder County AIDS Project, or BCAP, is a nonprofit organization that has been serving Boulder, Broomfield, Gilpin, and Clear Creek counties since 1985. We provide two essential services, care and prevention. Our care services provide resources to make sure that people living with HIV are staying healthy, happy, and ultimately living their best life. We have a food pantry that our clients can shop at twice a month, pro bono support like acupuncture, massage, legal and mental health, and insurance navigation. Our prevention services provide resources to the community such as testing, education, and outreach events. All of the services from BCAP, whether it's care or prevention, are completely free. So why is it important to talk about HIV? HIV has been a global epidemic since the 1980s. According to the World Health Organization, about 75 million people have been known to be living with HIV since the beginning of the epidemic. Currently, there's an estimated 38 million people living with HIV worldwide today. Here in the United States, there's an estimated 1.2 million people living with HIV. We have seen a consistent rate of about 38,000 new diagnoses annually, and of that number, about 1 in 5 people newly diagnosed are folks under the age of 25. Here in Colorado, there's an estimated 14,000 to 17,000 people living with HIV. Now you may have noticed that we don't have exact numbers, and we have kept saying estimated. That's because 1 in 7 people living with HIV don't know that they have it. So that's why we're here today. With the information that you take away from this presentation, ideally you can put it in the back of your brain so when you do need to apply it to real life situations, you can remember what we talked about. Maybe tonight over dinner, you can chat with your family about what you learned because they may even have outdated information about HIV. By educating our families, our friends, and our community, we can normalize this conversation and eliminate the discrimination that people living with HIV still face today. And hopefully, sometime in our life, we will find a cure. All right, so let's define what we're actually talking about. HIV and AIDS are often talked about together as the same thing in conversations, but they are in fact separate. So we're going to look at HIV first. The H in HIV stands for human. That means that HIV is only contracted from one person to another. Some people think if a mosquito bit somebody who had HIV and flew to a second person, that the mosquito can transmit it, but that's wrong. Mosquitoes can transmit illnesses to humans like dengue, malaria, or Zika, but they cannot transmit HIV. This is only human-to-human contact. The I in HIV stands for immunodeficiency. Yes, that word looks daunting, but I'm going to break it up in half. Immuno refers to someone's immune system, which helps fight off infections and keeps a person healthy. Deficiency means to be lacking, weak, or not working properly. When we put those two words together, we're saying that HIV is targeting someone's immune system and making it weaker. The V stands for virus. When talking about sexually transmitted infections, or STIs, they're typically grouped into two main categories: bacterial infections and viral infections. The main difference between the two categories is that one is curable and one is treatable. If someone gets a bacterial infection, they're able to take antibiotic medication to completely cure that infection. A viral infection is something that can only be treated. If someone is diagnosed with a viral STI like HIV, HPV, or herpes, that is going to be a lifelong diagnosis at this point in time. Fortunately, there are a lot of treatment options available today that someone can live a healthy life to control the virus in their body and stay healthy, but the virus will always be there in some shape or form. So how does HIV actually work in the body? As we just talked about, HIV is targeting the immune system. Specifically, it's looking for a person's T cells. If we look at our immune systems like an army, the T cell is the general, or the leader, and it tells the other white blood cells, or the soldiers, what to do. For example, If someone gets a sinus infection, the T cell recognizes it as an intruder, tells the white blood cells to fight it off, and if someone has a strong immune system, they have a strong army, meaning they're able to fight off that infection in a week or two. A healthy T cell count is about 800 or more per drop of blood, with about 1,500 being the maximum amount. As previously mentioned, HIV is targeting this T cell to start its replication process. Once a T cell has been invaded by HIV, it can no longer tell the white blood cells what to do. It just becomes a virus-producing factory, and that's its main purpose in life. Then, those viruses will find new T cells and do the same exact thing until eventually it starts hijacking and destroying all of the T cells. If this process were to happen long enough, and a person's T cell count were to drop from over 800 to below 200, they can receive what is called an AIDS diagnosis. So what is AIDS? AIDS stands for Acquired Immune Deficiency Syndrome. Acquired means that, yes, if left untreated, a person living with HIV does have the potential to acquire a large amount of the virus, but it's not necessarily automatic. In fact, many people who are newly diagnosed with HIV are doing so early enough that they're able to catch the virus when their T cell count is still high, so they may not ever advance to an AIDS diagnosis in their entire life. We already defined immune deficiency, and syndrome means that this is a collection of symptoms. We can't see a symptom like a headache or a sore throat underneath the microscope, so really, AIDS can be seen more as an umbrella term saying that someone living with HIV has a low T cell count and their immune system is really weak at that point. So to clear up some other differences between HIV and AIDS, HIV is the virus that can be transmitted from one person to another. AIDS is the advanced stage of having HIV. HIV is also considered a lentivirus, meaning it is very slow-moving. If someone was exposed to HIV today, they're not going to have AIDS tomorrow. This process, if left untreated or unknown that is in the person's body, can take anywhere from 8 to 10 years for a person's T cells to go from over 800 to below 200. HIV is also asymptomatic, meaning there are no symptoms or side effects. Some other STIs may have symptoms like painful urination, abnormal discharge, or sores, but none of those happen with HIV. That's why someone can have it in their body for so long without knowing. Lastly, you may have heard that people die from AIDS. That's technically not true. What happens when someone receives an AIDS diagnosis is that another illness, or an opportunistic infection, has the chance to take advantage of the weak immune system and deplete whatever resources that immune system has left. Common examples of opportunistic infections related to HIV and AIDS are pneumonia, the flu, and tuberculosis. So to clarify, people don't pass away from HIV or AIDS. It's the opportunistic infection caused by the weakened immune system that can be fatal. So now we're going to switch gears and talk about transmission. As you know, HIV is only transmitted by person-to-person contact. The virus itself is only found in 4 bodily fluids: blood, semen, vaginal fluids, and breast milk. So that means that other bodily fluids like saliva, sweat, tears, urine, and feces do not transmit HIV. In order for transmission to happen, a person living with HIV biologically has at least a couple of fluids in their body. One of those fluids containing the virus needs to come into direct contact with another person's bloodstream by crossing a mucous membrane in order for transmission to occur. If any of those bodily fluids leaves the body and is exposed to air, the virus deactivates within about 4 seconds. The ways we do see HIV transmitted most frequently are through sexual contact, sharing needles, and from parent to child. Because the virus is so weak in the air, casual contact activities like kissing, hugging, high-fiving, shaking hands, holding hands, sleeping in the same bed, sharing the same toilet, the same utensils or straws, or even eating food made by someone who has HIV does not transmit the virus. Prior to 1986, not all blood donations were being tested for HIV or other bloodborne illnesses. Fortunately, that's not an issue in the US anymore, so blood transfusions can no longer transmit HIV. Additionally, folks who work in medical settings like doctors, nurses, and other clinicians could have the potential of being exposed to HIV in their workplace by accidental needle sticks or surgeries. Fortunately, we have a medication today called post-exposure prophylaxis, or PEP. It works similarly to the morning after pill for unintended pregnancy, in that if someone is exposed to HIV, they start this medication within 72 hours of exposure. They take it for 28 full days and is over 80% effective in making sure the virus does not take hold in that person's body. The medication has been approved since about 2005, so it's still relatively new in the world of science and medicine, but because of this medicine, medical professionals don't have to worry about HIV transmission in their place of work. So going through the ways we do see HIV transmitted, parent-to-child transmission is on the decline. Yay! So anytime someone is pregnant here in the United States, we make sure that the person gets tested for HIV at least once while they're still pregnant. Should they be living with HIV, we'll make sure that they start treatment to keep the T cell count high and the virus low. We'll suggest that they have a C-section birth, which is a surgical procedure used to deliver the baby through the abdomen and uterus. We'll suggest that the baby receives formula rather than being breastfed. So because of all those measures we take, 98% of babies born to a parent living with HIV are born without the virus. So it doesn't really matter if one, both, or all parents living with this baby are living with the virus, because the baby can be born without it, no problem. Sharing needles for injection drug use can also transmit HIV. Even though the virus is very weak once it's exposed to air, there is an airtight, vacuum-sealed point at the tip of a needle in which there is no air passing through. Any blood that contains the virus can stay active in the point of this needle for up to 3 weeks. So if there's a group of people who are sharing the same injection equipment and one of them happens to be living with HIV, other people can be exposing themselves to the virus without even knowing it, as well as other illnesses like hepatitis, abscesses, and other infections. In an ideal world, drugs wouldn't exist, but because we know that this is a reality, we encourage people not to do drugs. However, should that be someone's lifestyle, we ask them not to share their equipment and go to what's called a syringe access program so they can get sterile supplies and eventually find recovery. Lastly, we have sexual contact that can transmit HIV: oral, anal, and vaginal sex. Oral sex is mouth to genitalia. For the person who is performing the oral sex, if they have a cut in their mouth, they just got done flossing, or they have a cold sore on their lip, those are all openings to that person's bloodstream through the mucous membrane of the mouth, meaning any of the fluids from the receptive partner containing the virus could pass through those openings and directly expose the person performing oral sex to HIV. For vaginal and anal sex, or when the penis penetrates the vagina or anus, the chance of exposure to HIV is increased. The walls of the vagina and rectum are made up of a thin mucous membrane tissue. During penetration, there's a lot of friction that occurs, and that friction can cause micro tears inside of the vagina and rectum, which again lead direct access to the receptive partner's bloodstream. For the insertive partner, if there is any ejaculation inside of the vagina or rectum, there is a natural absorption action that happens after that ejaculation. During that absorption, any fluids containing HIV from the receptive partner could be absorbed into the urethra of the penis and further into that person's bloodstream. If any of the partners involved in the sexual relationship have presence of another STI, especially one that has visual side effects like herpes or genital warts, those sores are just more openings to that person's bloodstream, meaning there is an increased chance of exposure to HIV. Knowing all this, how can we reduce our risk to being exposed to HIV? Number 1, abstinence. Abstinence means to abstain or not do an activity. So if someone chooses to abstain from sex and drug use and they were born without the virus, this is the 100% way to not be exposed to HIV. Another way to reduce risk is using condoms. If someone chooses to be sexually active, they should wear a condom with water-based lubrication. If someone uses oil-based lubrication, like Vaseline or baby oil, they both have chemicals in them that can actually weaken and damage the condom, making it ineffective. It's not possible to tell someone has HIV just by looking at them. The only way someone can find out if they have HIV is by getting tested. and we'll talk about that in just a little bit. Open communication is also super important to have in a healthy relationship. Asking your partners, when's the last time you got tested for HIV and other STIs? Or have you been tested for HIV at all? Maybe go get tested together. For people who use injection drugs, we encourage them not to share their equipment and go to a syringe access program to get sterile equipment and eventually find recovery. If a parent is living with HIV, we suggest that they opt for a C-section birth and use baby formula. Should someone have a suspicion that they were exposed to HIV, we can help connect them to start that post-exposure medicine as soon as possible. Lastly, there is another medication for HIV called PrEP, or pre-exposure prophylaxis. If you can think of PEP as the morning after pill for HIV, then PrEP can be thought of as a daily birth control. It's a one-a-day pill that someone not living with HIV can take to reduce their chances of the virus actually taking hold in their body. PrEP creates a shield around that person's T cells, so should they be exposed to the virus, the shield deflects it, and if HIV cannot attach to a T cell, then it's powerless. It's over 94% effective when used correctly, and it's safe for anyone to take. But the state health department does recommend that the following groups of people strongly consider starting PrEP: men who have sex with men, transgender individuals, people with partners living with HIV, and people who have multiple sexual partners with inconsistent condom use. The Colorado State Health Department now allows for people who are at least 13 years old to start PrEP without their parent or guardian's permission or insurance. Should this be something that you would like to consider, don't hesitate to reach out to BCAP and ask to speak to someone in the prevention department. So as we mentioned earlier, the only way to find out if someone has HIV is to get tested. Remember, HIV has no visual symptoms or side effects. Testing for HIV has come a long way since the 1980s. People used to have to go to their doctor's office, get several vials of blood drawn out, ship off the blood for a couple of weeks, and then get a call back after waiting for what seems like forever. Today, it's not like that. Today, we have a finger prick test, similar to if you know someone who has to check their blood sugar. We poke somebody's finger, we take a drop of blood, not vials, and we get their test result in a matter of 20 minutes. When we do an HIV test, we always want one line to show up where it says control, because that means that everything is working properly. If no second line shows up in the bottom two boxes, that means no antibodies or antigens were detected, meaning this person does not have HIV. However, if a second, or in very rare cases, a third line shows up, that means it's possible that antibodies or antigens were detected, and we would consider this a preliminary positive test result. Anytime we get more than one line on the test, we have to do a second test, called a confirmatory test, because these tests are 99.9% accurate, meaning 1 in 1,000 tests could have a false positive. So, anytime we get more than one line, we do a confirmatory test with our doctors at the local hospital, and we can confirm in about 2 to 3 days whether or not this was a true positive test result and move forward with a diagnosis and treatment plan from there. Fortunately, if the test reads negative, then it's 100% negative. The test itself is looking for antibodies and antigens in the person's bloodstream, and it takes about 3 months for those to develop. So if someone were to get tested today, we would be confirming their HIV status as of 3 months ago. If someone were to call and ask to get tested today because they may have had an exposure to HIV at a party last week, they wouldn't be given an accurate test result, because antibodies take more than 7 days to develop. However, if this person is worried that they were exposed to HIV last night or the night before, they're still within the 72-hour window period of PEP, and we would help navigate that process. Similar to PrEP, the minimum age to get tested for HIV in Colorado without parent or guardian consent is 13, and someone comes to BCAP for HIV testing, it's completely free. Our testing is also completely anonymous, meaning we don't need to know someone's name, phone number, or address. We create a code that links that person to their test, and none of their personal information is shared with doctors, teachers, parents, partners, or employers without that person's consent. We recommend that sexually active individuals get tested for HIV at least once per year. If someone is not sexually active right now, they've never used injection drugs, and they were born without HIV, it is not necessary to get tested right now. However, once that person does become sexually active, then getting tested once a year would be ideal. Lastly, we're going to talk about treatment. As we discussed earlier, HIV is a lifelong diagnosis. However, doctors and scientists have made great strides in finding effective treatment for people living with HIV so they can stay healthy. The treatment that people take is called highly active antiretroviral therapy, or HAART. HAART works by attacking HIV at multiple points in its life cycle, which allows the T cells more time to replicate and outnumber the virus. Eventually, HAART is able to suppress or tamper down the virus enough that a person's T cell count can return to a healthy range of 800 or more. When HIV is low enough in someone's body, we consider that person undetectable. The Centers for Disease Control, or CDC, has said that if a person living with HIV is undetectable, they have effectively no risk of transmitting the virus to their sexual partners. We still want people to practice safer sex because other STIs and unintended pregnancy can still happen. Fortunately, people who are living with HIV who are undetectable are staying healthy and having a strong immune system. They are keeping their partners safe, and because of this treatment, people living with HIV today have a lifespan within 2 years of people without the virus. So folks are living till their 70s or 80s and passing away from natural causes like old age rather than progressing to an AIDS diagnosis in their 30s or 40s. Unfortunately, the medication is really expensive. On average, it can cost about $25,000 per year per person. But that's why we have programs like Boulder County AIDS Project available. We're able to lessen the burden of how much medication costs so that people don't have to watch their entire paycheck come in every month and go right back out to the pharmacy. It's so that people living with HIV can have money left over and enjoy their life. They can go on vacation, buy new clothes, start families, and stay happy. The virus can no longer dictate how they're going to spend every single day. So thank you for listening to this presentation. If you have questions, please send them to your teacher or feel free to contact BCAP at 303-444-6121 and ask to speak to someone in the prevention department.